Welcome to the exciting world of bleeding and shock. So we're going to switch gears here a little bit because everything that we've done till now has been medical emergencies, and you really had to be an investigator and dig to find out what's going on. Things change a little bit in trauma. In a lot of cases, you're going to see automatically what your problem is. You arrive on a scene and somebody has cut their leg with a chainsaw, you're going to see that bleeding. You know that that is, if not all the problem, a significant portion of that problem. So what you need to know about trauma is it's one of the leading causes of death in the United States between people age 1 and 44, which really does make sense when you think about it. So you're going to be called to the scene frequently to deal with these traumatic emergencies, and it's important that you identify what the problem is and really control the situation, and in this case the hemorrhage, and looking at how you're going to treat shock. So just a quick refresher on the circulatory system. So the circulatory system, what we're looking at here is the blood, and the blood is what's circulated through the body through three major types of blood vessels, which are the arteries, the veins, and the capillaries. Perfusion. We've discussed perfusion several times already, so just remember it's good in, bad out. Okay, so let's talk about some of the functions of blood. One of the functions of blood is the transportation of gases. So it's going to carry the inhaled oxygen from the lungs to the body cell, and then carry the carbon dioxide from the body cell back to the lungs, where it's then exhaled. So remember, in with the good, out with the bad. It's also responsible for nutrition, so it's going to circulate the nutrients from the intestines or the stored tissues to other body cells. One of the other components of blood is that it's going to do some excretion, so it's going to carry the waste products from the cells to the organs. So the kidneys, for example, it's going to eliminate them from the body. Blood also protects, so it carries the antibodies and the white blood cells. Okay, remember the white blood cells, we're going to fight disease, fight infection, and the platelets and the clotting factor, and that's all going to control the bleeding. And then it's also, blood is also responsible for some regulation. So it carries the substances that control the body's functions, hormones, water, salt, enzymes, chemicals. It regulates the body temperature, and it carries the body heat to the lungs and the skin surface. Okay, let's talk about bleeding a little bit. If you can understand the characteristics of each type of bleeding from the three different vessels, it's going to help you identify how significant of a problem you're dealing with right now, or at least give you some clues to it. So let's go ahead and start with the arteries. So the arteries carry that oxygen-rich blood away from the heart. It's under a great deal of pressure during the heart's contraction. And arteries actually have a thick muscular wall that enables them to dilate or contract to control the amount of oxygen and nutrients delivered to the cells. So when you have an arterial bleed, you're going to notice that it has spurting blood. That spurting is every time the heart contracts, it pushes that blood out. Okay, let's talk about the capillaries. The arteries deliver oxygen-rich blood to the capillaries. Oxygen and nutrients pass through the extremely thin capillary walls into the cells. The carbon dioxide and waste products given up by the cells pass through the capillary walls and are taken up by the blood. A massive hemorrhage occurs when extensive wounds open up large blood vessels or many smaller blood vessels. The sheer volume of blood carried by some veins is enough to create an immediate life-threatening hemorrhage. A junctional hemorrhage occurs when the appendages of the body connect to the trunk, so it's those locations. So in these locations, the large arteries and veins tend to be less protected, and particularly vulnerable to traumatic forces. So the neck, your armpits, both sides of the groin are sites that you might see this massive type of bleeding. We don't often see massive external bleeding. It's fairly rare in our world, but when it does occur, you must treat it as soon as possible. As we see more and more gang violence and gun shootings, you'll see more and more hemorrhages. However, as we go on and we talk more and more about trauma, you're going to note that depending on the type of gunshot that you see, there may have been significant damage but very little bleeding. So there's a difference between hemorrhage and massive hemorrhage. So the vast majority of the external hemorrhage that you're going to see is not that massive hemorrhage. Remember though, any kind of bleeding is bad for the patient and needs to be stopped immediately. There's a great chance of infection, very high risk of infection. So if you can identify the type of bleeding that's occurring, it really kind of tells you what time you have. The amount of bleeding can be affected by several other things. Prescription medications that the patient may be on, that can affect the body's ability to clot. The temperature can affect the patient's ability to clot. So if they're hypothermic, so that's why we want to make sure we maintain the patient's body temperature. Make sure that you're always wearing at least one pair of gloves. You might want to consider wearing 2 pairs of gloves. So if the first pair gets excessively soiled, you can take that first pair off and your hands are still protected by that second pair of gloves. All right, so we've identified that our patient has this excessive bleeding or bleeding that we can see, and we need to figure out how we're going to control it. So controlling that external bleeding is one of the most important things that you can do in prevention and management of shock. And we'll talk about shock in a couple minutes, but really what shock is just that inadequate tissue perfusion. And obviously if your patient's bleeding out, they're not really perfusing the way they should be. Most of our external hemorrhage is compressible. That means that by applying that direct pressure, you're going to help control the problem. You're going to start with that direct pressure. It may not fix the problem, but it may slow it down a little bit. And if that doesn't work, then you're going to have to start going up the steps of what you would do next. So the first thing you're going to do is that direct pressure. If that doesn't work, then you're going to go up to elevating that limb if at all possible. Then you're going to go into hemostatic agents, and then you're going to, as a last resort, go to a tourniquet. Now let me explain, the tourniquet isn't the no-no that it used to be. Years ago, we did not want to put a tourniquet on anyone because we were fearful that they were going to use that, totally lose that limb. That's changed, the dynamics have changed a little bit, and we've decided in our transport times, we can stop the bleeding, get the patient to the hospital, the patient can get that definitive care there. The tourniquet can be removed in surgery when the doctor is fixing the bleed, and that patient will still have use of that limb. When you're applying direct pressure, the direct pressure reduces the force of bleeding and allows the blood to clot and plug the hole. So there's steps to applying this direct pressure. You want to apply firm pressure with your palm of your hand, or your fingers if it's a smaller wound. In the case of a junctional hemorrhage, you may need to lean into the wound and apply your body weight to enhance that pressure. Small wound, small pressure. Larger wound, more pressure. If you can apply pressure between your hand and a bone, bleeding control will be more effective. Continue to hold that pressure until the bleeding is controlled. Once the bleeding's been controlled, you can bandage a dressing firmly in place to form a nice pressure dressing. You don't ever want to remove this pressure dressing. Once you put it on, you leave it there, because if you remove the pressure dressing at all, you're going to remove any of the clots that have formed to help stop that bleed. If the dressing becomes soaked, just put additional dressing on top of it. Again, don't remove what you already have. Just remember that if you're bleeding through a dressing, this is a sign that your pressure dressing isn't really doing what you want it to do. So you want to go a little bit tighter, or you want to change your method. If that wound continues to bleed, you should consider something else, maybe get a little bit more aggressive and go to the next step. So maybe now you're going to have to step it up to the hemostatic dressing or a tourniquet. A pressure dressing will really control most of your external bleeding. Place the several gauze pads on the wound, hold the dressing in place, and then start bandaging the wound tightly over the dressing that you already have, above and below the wound site. Make sure that you are creating enough pressure to control the bleeding. Remember, at this point, this pressure dressing is not a tourniquet, so you don't want to cut off blood flow to the other portions of the body or the particular limb you're dealing with. You just want it at this particular location. In most cases, when you're applying this direct pressure or using a pressure dressing, you can elevate the limb at the same time. It's quick and easy to do, but don't elevate that limb if you think that there's a musculoskeletal injury, if there's an impaled object, or if you think that there's a spinal injury. The hemostatic agent. Hemostatic agent we actually got in EMS, once again, from the U.S. military. So those hemostatic agents are products that are designed to enhance the direct pressure ability to control bleeding. So we're going to pack this quick clot in there, and that's really what it looks like, is similar to the gauze that you're already using. And these usually work because there is a material applied to that gauze that's going to absorb the liquid portion of the blood and leave the larger portions of the blood to formulate the clot. All right, and lastly, let's look at the tourniquet. The tourniquet's a device that closes off the blood flow to the entire extremity. When you've used the direct pressure and that hasn't worked, it's not appropriate for what's going on here, we're going to go ahead and jump to the tourniquet. The tourniquet does not go directly over a joint. You're going to put the tourniquet approximately 2 inches above the bleeding wound. Okay, so the tourniquet. Really, you should be using an official tourniquet, a commercial tourniquet. We'll talk about that in the next slide. But if that's not available to you, I want you to get creative and think about what you might have on your ambulance that you could use as a tourniquet if need be. So think of your triangular bandage that you might use as a sling. That might be something that you could use as a tourniquet. Don't ever use anything like rope or wire. That's not really going to help. All it's going to do is cut into the skin. It's not really going to stop the bleed. Remember, once that you've applied a tourniquet, you don't remove it or loosen it unless you have orders by medical direction. Tourniquet should always be used between the wound and the heart. Make sure that you tighten it to the point where the bleeding is controlled. There should be no distal pulse palpable. And tightening a tourniquet can cause great pain. If you've applied one tourniquet and you've really gone about as tight as you can go and the bleeding is still is pretty massive, you might want to consider putting on a second tourniquet. So again, just remember that all hemorrhage control should begin with just direct pressure. If the bleeding isn't controlled by that, and the wound is on an extremity, then a tourniquet could be applied, and really at this point should be applied. If direct pressure is ineffective and the wound is in the trunk or the head, then you want to go to a hemostatic agent. One thing that we really haven't talked about yet is bleeding that might be associated with a musculoskeletal injury. That can usually be controlled by just properly splinting the injury itself. And another key, something that might help when you have to control some bleeding, is actually just applying some ice or an ice pack, which we have limited access to on the ambulance. If this is a traumatic injury that has a skull fracture, there might be bleeding or some cerebral fluid from the ears or the nose oozing from the ears or the nose. Okay, don't attempt to stop this bleeding or this fluid loss. You don't want to put any padding or anything there. Don't apply any pressure to the nose or the ears. All right, I realize it's kind of hard to see here, but this is just how you would apply a CAT tourniquet, which is one that we commonly use in pre-hospital now. Some places you're going to see different, it's going to look similar to an AED box or a fire extinguisher box, and they're actually going to say stop the bleed. And within those stop the bleed kits, you would open up that case. You'll have different packets in some cases. You're going to have these CAT tourniquets. You may have some other gauze, other bleeding control methods in there. Okay, so this is actually what a CAT tourniquet looks like. And if you take the time, I would really appreciate if you would jump to this link. And it's not a very long video. It's maybe 5 minutes or so. And they're actually going to show how you apply a CAT tourniquet.